Welcome, everybody. I'm Chris Newfer. I'm the chair of the Virginia Caregiver Coalition. Thank you all for taking the time today to join us. We have an all-star presenting team today to talk about the caregiver scorecard and the nuts and bolts of that. I just want to check in with everybody. Nick has been great at sending out these announcements, and just want to be sure that everybody has received them. And if you missed them, I'm going to review some of the most recent ones that have gone out. And if you want more information on it, just put it in the chat box, and we'll take care of getting you a link to the information. Looking at one, which is right in our wheelhouse, which is the LEAF program, Life Enhancing Activities for Family Caregivers. There is a study going on now that anyone who's the primary caregiver of a person diagnosed with Alzheimer's disease and has access to a reliable Wi-Fi, they can be eligible. The idea is to participate in positive emotions building program with 6 weekly hour-long video sessions with a facilitator or a 6-week self-guided program, and nightly home practice to reinforce the skills. So it's an interesting opportunity to learn and also help participate and build out input and research for this for life enhancing activities for family caregivers. Let's see. One other thing I wanted to mention is the Rural Dementia Caregiver Project. Now, this is something that's going on the West Coast, but you can join in. The blurb that they sent out is, "Are you a stressed caregiver for someone with memory loss? A free workshop might help." Sponsored by a federal government grant, this workshop is for family and friends who care for people with memory loss and live in a rural area. Participants will receive up to $80 in cash for completing 4 surveys. Zoom and video are not required to participate. For more information, go to caregiverproject.ucsf.edu or call toll-free 1-833-634-0603. And if you didn't get that information, just raise your hand in the chat and we'll send it along to you. The idea is if any of your stakeholders could benefit from these programs, we encourage you to forward the information out to them. I mean, in this regard, Virginia Caregiver Coalition serves as a clearinghouse for agencies around the state, and the information that we send you, we hope you will send out, distribute further to people in your community or in your catchment area to provide them with new programs. And that's, what we try to do is introduce caregivers around the state, both people that work for agencies and individual caregivers, to innovative new programs that are going on, and try to keep you up to date with that, along with trying to keep you in touch with, informed about any legislative initiatives that might be beneficial. So with that said, I would like to welcome some new members. Jeremy Beruskin is up in an airplane, I think Nick told me, flying around, trying to join the meeting from the sky, but we want to welcome Jeremy. Also, 2 new members, I don't see them here, but Kayleen Landers and Brianne Chenoweth from Nurse Next Door Home Care Services down in the Tidewater area. We are very fortunate as well to have Dr. Zipporah Levi Shackelford with us today, and welcome to the VCC, Doctor. And I'd like to give you an opportunity to introduce yourself to the membership and let us know a little bit about yourself.
Well, thank you. Good morning. And I apologize if I sound a little off. I am suffering from a sinus infection, so forgive me. But I'm Zipporah Levy Shackelford. I'm the founder of Creative Approach Development Center, which is an organization in Richmond where I provide behavioral supports and academic supports for those with various diagnoses and learning needs. I also provide a lot of training for caregivers and educators and support persons on helping those with diverse abilities and learning styles. So yeah, we offer a variety of activities and events. Like on June 30th, we have a scavenger hunt walk coming up for those of all abilities at Cheswick Park, and just trying to find different ways to close developmental gaps and achievement gaps, and then also provide some activities that are accessible to all. So a good variety of everything, but I was invited and to join by Moretta Copeland, who I know through the Virginia Len Project. So really happy to find out about the group and to meet some others who are in the, in the same field and working towards supporting caregivers. And I don't know if I said this, I'm also a special needs mom. I have 4 children and 3 are on the autism spectrum, and my youngest has a rare form of Down syndrome as well. So definitely get the caregiver side as well as the professional side.
Thank you, Doctor. It's wonderful to have you. Thanks for joining. Kathy, do you have any news or updates from DARS that we might be interested in?
Sorry, took me a minute there to get unmuted. No, just that we are actually, tomorrow we are submitting a grant to ACL for a lifespan respite grant that will be in the neighborhood of $1 million grant for a 5-year period. There are only going to be 8 grant awards, so there's no guarantee that we will get it, but that's what I will be working on the rest of the day, furiously trying to get the budget done so we can submit tomorrow. So that's kind of consumed us around the office.
Okay, thanks, Kathy. Good luck with that. That's a big, big piece of our efforts, and keep our fingers crossed for that. Any other news that members might have? Dee, any word on when Senior Connections might reopen?
Good morning, everybody. I don't think that we are, actually. I think from here forward, we're going to be by appointment only.
Okay.
Now, we will reinstitute the home visits of doing assessments in people's homes, but we're not sure when that will be either.
Okay.
One last thing, the Cool Care program, we are in the process of taking applications for that. So that's for fans or window air conditioning units.
Okay. All right, thanks.
Mm-hmm.
All right, Donna, any updates on upcoming programs that people might be interested in?
Okay, upcoming educational programs for this group?
Yes.
I've been talking with Moretta Copeland from the Partnership for People with Disabilities to do a program in July. And I think we've talked about support groups for later in the year and another follow-up for the AARP scorecard. We're working on mapping out that calendar now.
Good. That's something to look forward to. And thanks for
we'll have more information to come.
Okay. Well, I can't thank you enough for all the work you've done, you and your committee have done for providing some really terrific programming for us over the last couple of years. So thank you for that.
Thank you.
Okay. So let me just check in. Any Any other new business before we get to our program for today? Trying to stay on schedule.
Chris, we have another new member on board apparently. Danita Prakash.
Oh, okay. Hi, Danita. How are you?
Hi, I'm good. How are you?
Good. Can you introduce yourself to the group and tell us a little bit about yourself?
Certainly. Thank you so much for inviting me to join. I will give you a little background. I'm a tech marketer. I've been in technology for 20 odd years. And I also currently teach in innovation programs at George Washington University and George Mason. But I've recently applied for an SBIR grant for a startup I'm working on to test some technology around financial and legal caregiving for caregivers and their loved ones with Alzheimer's and dementia. So I'm looking to launch a community on this topic in the near future. I'd love to pick some of your amazing brains on this call for who might be best resources to bring into that community. I'm trying to connect with those working in financial and legal planning today who help with these types of situations. So if anyone has recommendations of people I should speak to or partner with, I'd love to hear that. Also looking to build a very diverse community, so people who could reach into the caregivers in a variety of communities. I'd love to speak to you as well. So thank you again for letting me join. I hope to learn a lot from you all.
Thanks, Danita. It's wonderful to have you. Okay.
Hello.
Yeah.
I want to introduce myself. I'm also new to this.
Oh, hi,
group.
Marjorie. How are you?
It's actually Joe. Joe is my nickname.
Okay.
I know several of you. I worked at Senior Connections for 30 years, so I know Dee, and I know Kathy really well. She was my supervisor for many years. So I wanted to join because I'm working with Station Advanced Care Planning, and we actually are seeing people face to face, but we also have conversations with people over the telephone or virtually, if that's what they're comfortable with. And we do legal documents. So we do wills, powers of attorney, and advanced medical directives through a new benefit from Medicare. Well, actually, it's not that new anymore, but most people don't know about it. It started in January 1st of 2016, and it's the Advanced Care Planning Conversation. So we actually go into people's homes. We go into congregate independent living communities, and we meet with people, and we do programs, and then we sign people up to have these conversations. And for a lot of people, it's totally free. I'd say for most people, it's totally free. For some people, they have to pay a copayment, like their Medicare copayment. So I just wanted to introduce myself and just let you know that we're out there.
Good to see you, Joe.
Hey, Kathy.
Thanks, Joe, and thanks for joining us. It's wonderful to have you. Again, we try to bring innovative new programs to caregivers around the state. And so, this is a perfect example of what Joe's doing. And if you are a caregiver who wants to participate in this program, obviously, or if you know someone that could benefit from the conversations at Advanced Care, please, let Joe know. Just tap in the chat box and could reach out to her. All right. Thanks again, Joe, and thanks for joining. Okay. George, are you going to lead off with the introduction for the program today?
No, I think Christy and
Christy?
David are
I think
starting.
I'm tagged for that. So
Okay,
sure,
great. Great.
Sure. Good morning, everybody. I'm happy to be with you all. I'm a former chair of the Virginia Caregiver Coalition, so I believe very strongly in what this coalition can do. I recognize a lot of faces and names and others that are new. So thanks for being a part of this today. So I'm joining you from my office in Williamsburg. I'm with the Riverside Center for Excellence in Aging and Lifelong Health. I'll tell you a little bit more about what we do at our center if you're not familiar in a few minutes, highlighted on one of our slides. But in the interest of time, and that we only have David from AARP Virginia for a short while before he heads into another meeting. Nick, if you wouldn't mind, maybe we'll go ahead and share the slides and get started. We're going to talk to you today about the AARP scorecard. So if Nick, do we have everybody kind of on a forced mute and then do kind of Q&A at the end? Can you just remind me your plan for that?
Yeah, I have usually people are muted during the presentation and then we open it up at the end.
Perfect. Okay, thank you. I think that'll be fine for George and David and I. So you all can put things into the chat, and Chris and Nick will help us kind of monitor that, and we'll make sure we get to it when we're done. But wasn't sure if you all were familiar with AARP's long-term services and support scorecard. And so we want to give you a little background, and we want to set the context with what the scorecard looks like at the national level and then at within Virginia, and one particular part of the scorecard that does focus specifically on family care. So we're bringing this to you on behalf of DARS, Riverside, and AARP. So next slide. Thanks. So there are, as you all know, each month has many, and each day now has a recognition to it. So just wanted to highlight some. There may be others that you're recognizing this month, but certainly for many of us, maybe at the top of the list is Older Americans Month, and the initiatives by the Administration for Community Living around, focusing on the value of older adults and what they bring to community is really the theme for this year. But it's also Military Appreciation Month. I see one of my colleagues, Daphne Eaton, who's on with Virginia Veteran and Family Support here today. If you have needs or questions about military support and veteran support. It's also Mental Health Awareness Month. And I actually want to share something with you quickly. You all may be familiar with, but if you're not, you may want to take a look at RAFT, which is based in Annandale, that focuses on mental health. And I appreciated their newsletter that just came out that says everyone has mental health. We might not always think about it in the most positive way, but their recent newsletter just reminded us that mental health and self-care are composed of physical, psychological, emotional, and social self-care. So I just thought that was kind of a neat way to think about Mental Health Awareness Month. So that was a newsletter by RAFT, the Regional Older Adult Facilities Mental Health Support Team, again, based in Northern Virginia. It's also Arthritis Awareness Month, Better Hearing and Speech Month, Osteoporosis Awareness and Prevention Month, and Stroke Awareness Month. And again, this is not all-inclusive list, but just wanted you to kind of be aware of many of the recognition programs that are going on in May that tie to the work that we all do. Next slide. So let me introduce David DiBiase, and David, you stay with us as long or as little as you are able, but David's going to highlight a few things on this particular slide. So he's Associate State Director for Advocacy and Outreach with AARP Virginia, and he's helped develop public policy priorities and lead tactical implementation of the association's state and federal advocacy. He co-led Governor-elect, I guess that wouldn't be Governor-elect, but now Governor McAuliffe's transition team for long-term services and supports, and currently on Governor Northam's COVID-19 long-term care facility task force. So before he was with AARP, he was a public health nurse for county, city, and state health departments and a leader in the World Health Organization region of the Americas effort to eliminate tuberculosis. He has a bachelor's in nursing from the University of Connecticut and completed some graduate work in divinity at the Catholic University of America. And in David, no particular order, I like to say he lives with his wife, his cat, and his guitar in Richmond. So I'm going to pass it to David, and thanks for joining us from AARP Virginia.
Thank you. Thank you to your leadership, Christy and George, for bringing the scorecard to this group. And thank you to Connie Skaggs for representing AARP here monthly. So AARP is a nonprofit, nonpartisan organization. And our vision, I think, is quite beautiful, that all people live with dignity and purpose and fulfill their goals and dreams. We have a three-pronged approach, which is service, education, and advocacy carried out by staff and volunteers. And our work generally falls into three categories: health, wealth, and self. You should, your health should live as long as you do, your wealth should live as long as you do, and your happiness should live as long as you do. We're 62 years old, and we have an office in all 50 states. We have a heavy presence in Washington, D.C. Our founder was Dr. Ethel Percy Andrus. She's in the Women's Hall of Fame. She started AARP at 74 years old after a lifetime of service and accomplishment. We don't sell insurance, although I think at times it looks as though we do. Switching over to what is the scorecard? It's a way of helping states benchmark their performance across a number of variables in the long-term services and supports world. And it's from the viewpoint of the user and their families. Hopefully states can look at the scorecard and pick up the pace in creating a high-performing system of care for older adults and adults with disabilities and the family caregivers who care for them. Our partners in this were the AARP Foundation, the SCAN Foundation, and the Commonwealth Fund. In terms of our role in advocacy, we either take a leadership role or a strong partner role on the national level and on the state level. Our priorities right now for family caregivers are workplace flexibility. That includes family leave and paid sick leave, and eliminating discrimination for those who have that leave and use it. A family tax credit, which by the way, on the federal level was introduced to the House yesterday. More respite care, greater access to telehealth, and a family caregiver assessment. As we all know, family caregivers' needs have to be met, but you can't meet them if you don't know what they are. At the state level, we advocate at the General Assembly, but we also advocate in non-legislative ways, getting the governor to do executive orders or being on an advisory panel to DMAS, working with DARS, working with the Joint Commission on Healthcare. We play a lot of roles, again, leadership, support. This year we supported paid family leave. It was not our priority. In any given year, we might have a family caregiver issue as a priority or as just a support. It really varies on the politics of the state. And that's my 3-minute warning. I'm going to stick around for as much as I can, but I have a task force meeting starting at 10 that I might be late for. Thank
Great,
you.
thanks, David. And if David needs to slip out here shortly, our very last slide has his contact information. So he's okay with us sharing ways that you can reach out to him and connect. And I think you're going to hear over the next 30 or 40 minutes or so that we all, the three of us and the different agencies that we represent have kind of different perspectives about advocacy and what we can do as an individual versus what we can do in the agency that we represent. But David's all in, I'd say, in terms of, the advocacy, and we're grateful for that and grateful for him when he can update us on what legislation might support family caregivers and how we can, contribute to that in a variety of ways. So thanks, David. Nick, next slide. So I just wanted to take this opportunity to, if you don't know about our center here, that we are going to be celebrating our 20th anniversary next year, which is really exciting and hard for me to believe because I've been with the agency since we applied for our nonprofit status before we were a part of the Riverside Health System. So we've developed a kind of an alignment with the Riverside Health System in 2009, and then in 2012, those of us working for the center became Riverside employees and our center was renamed, but we retain our own kind of smaller nonprofit status, and we sit within a larger nonprofit, the parent company, Riverside Health System, that's based in Eastern Virginia. So my office is in Williamsburg, and we're a small team there are 7 of us. Today, our office is bustling because we have both driver evaluation clinic underway and our geriatric assessment clinic. So we have 4 patients coming in for geriatric assessments today and 4 coming in for driving evaluations. So Thursdays end up being a particularly busy but exciting day for us. On other days, it's much more quiet, and we're just at our computers and doing our research and doing our community programming. But we really think about ourselves in these 3 areas, and the health services research is the program that I oversee, which has a lot of challenges to it because much of what I do is grant based. So it involves a lot of grant preparation. So you just heard Kathy talking about their lifespan respite grant they're getting, and I actually am trying to submit one to the Agency for Healthcare Research and Quality tomorrow to expand one of our medication review programs for older adults. So I spend much of my time looking for and securing and then maintaining that funding at the state and the federal level so that we can bring caregiver programs to Virginia, often from other communities around the country. So for example, we are engaged in a dementia care coordination program that's based on an evidence from the Benjamin Rose Institute out of Cleveland, Ohio. And we wouldn't have probably been able to bring that to the eastern part of Virginia had we not had funding from the Administration for Community Living, and then to develop a good partnership with the Benjamin Rose Institute on Aging. And in fact, George and I are going to be presenting a little bit more about that program and its impact in Virginia next week at the Virginia Governor's Conference on Aging. So if you have not registered and you have an interest in being a part of the Virginia Governor's Conference on Aging, it is virtual and it is Monday through Thursday of next week. So in addition to kind of the research and community programming that I oversee, we also have these clinics that I've mentioned. So we do provide direct services that are fee-based, always with a sliding scale. We're fortunate that we have funds through the Grand Driver program right now at the state level to provide some driving assessments at a significantly reduced cost. We do provide a number of support programs for caregivers and educational programs, some of which are free and some of which have some modest expenses. And then the community engagement piece, we also value. So just wanted to kind of give you a snapshot of that. Our website doesn't do justice, I don't think, to what we do, and we are in the process of kind of re-envisioning what the website is going to look like, kind of sitting within a health system. I will say that when we merged, when I was part of this nonprofit before we became a part of Riverside, and I wasn't quite sure what that was going to look like. So we went from a staff of 6 to being a part of 10,000 people in a moderately sized healthcare system. And not only was that kind of intimidating, all the processes and bureaucracy that kind of comes with that, but I really have to say, very honestly, that I'm grateful for what our health system is doing to be dedicated to lifelong health. And so our center sits under a division within the health system that's called Lifelong Health. And I'm very grateful for what our health system is really committed to serving older adults and how we can serve the health system as a whole, and the community at large as well. Next slide. So I want to take just a few minutes before I pass it to George. He's really going to get kind of into the nuts and bolts of the components of the long-term scorecard, but I did want you to know how you can access it. So David gave you a little bit of background, but if you just go to longtermscorecard.org, and there's even a way you can sign up and be in touch with folks at the national office to get more information about the scorecard. So I just want to tell you a little bit about my history with the scorecard and a little bit about the background. So the scorecard is released every 3 years. It was first released in 2011. So that means we have a scorecard on all the states and Washington, D.C. back to 2011 through 2020. So 4 of them. So 2011, 14, 17, and 20. And I probably first became aware of the scorecard in 2014. And I was attending an event in DC that AARP had sponsored with another program they oversee called REACT, which is an initiative to support working caregivers in particular. And so that's when I first became exposed. And as I learned about it, I thought, okay, how can I learn more? And where does Virginia fall in this? And so you'll learn in just a little bit that Virginia fares pretty well in the long-term scorecard overall. So George will share that with you, but we've been ranking around 18, 19, 20 in the scorecard overall. But when you then look at some of the specific categories within the scorecard, caregiver support being one of them, we do not fare well. In fact, it was shocking to me as somebody who's been an advocate and somebody who's studied this discipline for 20 plus years. In fact, I was upset. And I used that to, for example, we ranked at 45th at one scorecard. Currently, we're like at 48th. And when I saw we were at 45th, I couldn't imagine we could have gone anywhere but better, and we didn't. And so I want to share that with you because it was humbling. And then as I dug into it, I went, okay, maybe this makes a little bit more sense why we're ranked so poorly. It isn't because Virginia isn't doing amazing work. Through this coalition, through DARS, through the Alzheimer's Association, through healthcare systems and all the other agencies that you represent. But it's that those programs we're involved in don't necessarily get counted or rolled up into the scorecard. So it took me a while. I just kind of wanted to let you know how I processed this because I was very upset. And then I'm like calling folks at DARS and at AARP Virginia saying, how can we make sure that the national AARP office, when they put together this scorecard, knows that we're doing this and this and this. And so there are some awareness opportunities we can capitalize on. But right now, and you'll learn a little bit more about this from George, is that the metrics are what they are. And so they're very limited and they don't necessarily capture all of the good things that we're doing. So with that said, you can follow the link I have here, and Chris or Nick can help make sure that you get the slides afterwards. You can follow last fall when they released the scorecard. There was a live webcast that is captured, and you can go back and watch from the AARP staff at the national level talking about the work that went into releasing the most current one. So now we're talking about 2023 will be the next scorecard. And I think we'll leave you with some food for thought about how we might, as a coalition or as individuals or as the agencies that you represent, help move the needle on some of these areas where we either weren't scored at all or we scored pretty poorly. So I do think we have some opportunities, and the good news is we have till 2022 or so probably to help inform some of that. Also provided you with some links to some other publications and some promising practices that are highlighted. Next slide. So I'm going to pass it to George. I'm going to ask George Worthington, I'm guessing many of you all know him as our state dementia coordinator, to introduce himself a little bit about his background. And then he's going to take the next little bit to kind of walk you through Virginia and all our metrics under the long-term scorecard, but specifically within the caregiving one. George?
Thanks, Christy, for that great beginning to this and great description and introduction to the scorecard. Good morning, everybody. I'm George Worthington. I'm the Dementia Services Coordinator with the Department for Aging and Rehabilitative Services. And in that role, I help support policies that will help improve the quality of life and care for people living with dementia and their caregivers. Support the Alzheimer's Disease and Related Disorders Commission, which is the advisory body to the governor on all things dementia. And my background is I was an economist for many years, so this kind of data rich topic really appeals to me. So if I get too caught up in the numbers and the kind of wonkish aspects of it, just maybe Christy can stop me. But it is interesting to dive into the scorecard, so we'll do that. After my career as an economist, I studied clinical psychology, and that brought me into the dementia space. So, as Christy said, I've been working on the dementia care coordination projects for a number of years, and joined DARS in 2018. So many of you know me from that role. So with that said, I'll jump in. So the scorecard has a number of components, as Christy mentioned. So you can see them listed here. Overall, Virginia scores 19th on the long-term services and supports. And we do particularly well in areas like affordability and access and effective transitions. So transitions would be transitions from hospital to home or to other care settings. Affordability and access, that would be things like ensuring that there are enough Medicaid users per the percentage of population with ADL disabilities, that we have no wrong door system or ADRC system. Many of you are probably familiar with Virginia's no wrong door, and that care is affordable. But where we do particularly poorly is the support for family caregivers. And so this being the Virginia Caregiver Coalition, that's the area we're going to really focus on. As you can see, we're 48th there. So that is concerning. But as Christy said, it really doesn't capture everything that the state is doing in the caregiving space. It's limited by choosing metrics that can be compared across all 50 states in the District of Columbia. Just looking in the chat, Donna is saying the lower the number, the better the score. Yes, that's correct. So that would be number 1 being the best and 51 being the lowest. Then at the bottom of this slide, you see the number of indicators for which the state ranked in the top in the different quartiles. So that's every sub-indicator of the scorecard. So it's not just the caregiving, but unfortunately, all of those 4 that ranked in the bottom were in the caregiving space. Next slide. So this is just a visual representation of that, of what we showed you on the previous slide. So you can see 19th overall, pretty good. And all the other indicators are pretty much in that same range. And then support for family caregivers is right at the bottom there. Next slide, please. So here you can see how Virginia ranks compared to other states on just that support for family caregivers section. So you can see we're in company of lots of our neighboring states. We're all in the bottom quartile. On the other hand, DC ranks number 1 in the country for support for family caregivers, and Maryland is in the 2nd quartile, so ranks pretty well. You can see that most of the good performers, the top performers, are on the West Coast and New England, and then Minnesota, which has long been a standout in support for family caregivers, and especially in the dementia space. So for those of you who are familiar with things like dementia-friendly communities and dementia friends, those all came from Minnesota. So next slide, please.
And George, if I could add, it's only sort of a joke that Hawaii is one of the top ranked, and that it really would be nice if, you know, the coalition were to make a field trip to go see how they're doing in Hawaii and why they are ranked higher than we are. We can go visit DC a whole lot more easily and less expensively, but Hawaii also wanted to you all to be aware it's ranked in the top quartile as well.
Thanks, Christy. Yes, I'll add that to my request for next year. So within the supporting family caregivers component of the scorecard, there are 4 subcomponents. So this the support for family caregivers is really the most complicated portion of the whole scorecard. It has lots of subcomponents, which the other ones don't, and they're all broken down as well. So you can see that for overall, the maximum possible score is 28.5 points, and states are awarded points for the number of policies that they have or the number of programs that are able to access certain supports. So for example, but the most important one is the supporting working caregivers. And I'm going to go into each of these components in a bit more detail. We'll talk about what progress Virginia has made and where we can do more. So next slide, please. And this is looking at the total number of points available and where we get. So overall, we get 4.5 points out of the 28.5. We do get almost full marks for nurse delegation and scope of practice, which means that nurses are allowed to delegate certain tasks, certain care tasks to non-clinical staff. But we get 0 for supporting working caregivers, and that's the most important component. So next slide, please. So these are the different subcomponents of that supporting working caregivers section. As you can see, so there's family responsibility protected classification. The state exceeds the Federal Family Medical Leave Act. That there's paid family leave, mandatory paid sick days, flexible sick days, or unemployment insurance for family caregivers. And all of these require legislation. So that's this is an area where there's plenty of room for advocacy, and Christy will talk a bit more about that later in the piece. But I'm going to talk about each one of these and what they mean so that you understand. But the family responsibility protected classification is the extent to which state or local law includes family responsibilities, including care provided to aging parents or disabled spouses, as a protected classification that prohibits discrimination against employees. So that means places that have these policies in place mean you can't lose your job for taking time off to care for a family member. Only 2 states in the whole country have statewide laws, and localities in a further 21 states have some protection. So you can see this is an area where really there doesn't exist much anywhere in the country. And maybe that's not the best place to start any push for change. The Family Medical Leave Act, so many of you are probably familiar with this. The Federal Family Medical Leave Act requires organizations with more than 30 employees to provide unpaid time off to their staff to care for either themselves or for immediate family members. So what the scorecard looks at is how any given state exceeds those requirements. So for example, they might extend the benefits for more than 12 weeks, or they may extend the benefits to allow people to care for non-immediate family members. So for example, a parent-in-law. And that's something that many families face. For example, a wife is caring for her father's mother in their home. So under the federal FMLA, she would not be able to use her family medical leave to care for that person. Or they may allow benefits for workers who haven't worked the full 6 months that the federal act requires, or they extend it to smaller companies. So there are many different ways that states can exceed those FMLA provisions. Overall, out of the 51, just 10 states receive any points there. So again, that's an area where not much activity has happened anywhere. But the next three categories, you can see there in italics, though there has been some legislative activity, meaning bills introduced in the General Assembly within the last 3 years. So paid family leave is currently only available in 9 states, but 11 will have it by 2022. So this would be paid time off to look after your family members. Mandatory paid sick days. 20 states out of the 51 have statewide or local laws that mandate paid sick days. And we looked, there was a study done by some researchers at Old Dominion University a few years ago under the RDRAF, Alzheimer's Research Disease Program, that showed that 35% of the people that they surveyed could not afford to take unpaid leave to care for a family member with memory problems. And the same study showed that roughly 60% experienced moderate to severe financial hardship as a result of providing unpaid care. So we know that most care is provided in the home by unpaid family caregivers, and many people are suffering financially as a result of that. So mandatory paid sick days is one way to help address that. Flexible use of sick time, so that would be allowing employees to use their own sick time for family caregiving responsibilities. 19 states out of the 51 have statewide legislation currently. And the ODU study showed that this was the most frequently requested strategy to help working caregivers. So this is something people really want. And as you can see, there has been some activity in the General Assembly, so this might be a good topic to educate people on. Finally, unemployment insurance for family caregivers is available in about half of states, so that means people can access benefits when returning to the workforce if they left their job due to their own illness or to care for an immediate family member. Okay, next slide, please. So the second of the 4 components where we do get a point is person and family-centered care. So this has 3 subcomponents: spousal impoverishment protections, having a caregiver assessment, or CARE Act legislation. So Virginia does have the CARE Act. It was passed, well, it came into force in 2015. It provides for the clear identification of family caregivers and the receipt of any supports, needed supports in education before a loved one is discharged back to home from hospital. So this, I took a screenshot of a AARP card that tells you what your rights are under the Caregiver Advise, Record, and Enable Act. And you can find that at that link. But it's a handy thing if you don't know that you can request education or a demonstration of medical tests that you're expected to perform at home, then this card will remind you that you do have that right. And just some examples of why that's important. So if somebody is caring for both of their parents in their home and has to coordinate various health needs, including when one or both of her parents have been hospitalized, the CARE Act can ease the stress of caring for her aging parents by providing practical information when she needs it. The one above that, having a caregiver assessment. So that's where states assess family caregivers when they are assessing the needs of an older adult or an adult with disabilities for whom they're caring for various programs, including Medicaid, programs under the Older Americans Act, and other federally mandated or supported programs. And currently, 41 states have caregiver assessments required in at least one program. So basically, that means if we're assessing somebody for their own health risks, for example, then we'd be assessing the caregiver at the same time. And states can get a quarter of a point for up to 8 programs, I think. So currently Virginia doesn't have any required caregiver assessments for those programs. And the spousal impoverishment protections. So this is where states exceed the federal minimums. So for example, if the federal maximum, where the states exceed the federal maximum. So for example, if the federal maximum income that can be protected is $3,160.50. If that is the state minimum, the state receives points for that under the scorecard. And currently only 7 states permit this. So again, it's not very widespread.
George,
Next.
do you mind if I make a
Yep.
comment just about these two, Nick, before you move to the next slide? So,
Sure.
and I think about this today because as I shared with you all, we have our geriatric assessment clinic happening right now. It's a multidisciplinary, interdisciplinary team. We have well, today we have a geriatric psych nurse practitioner. Usually have our geriatrician, but she's out of town. So we have a nurse practitioner, our counselor, our nurse, and a pharmacist that make up our interdisciplinary team delivering these assessments today. And they meet, so you must come if you are the patient for whatever reason. Often it's memory loss, but for whatever reason, the older adult is coming in for a more comprehensive assessment that primary care couldn't put their fingers on. That you must bring at least one family member with you to kind of provide some background information to the story. And often the team will meet with those 2 individuals separately. And so we don't have a formal caregiver assessment here, but we could use one. And our team would be very open to it. So I just give that as an example. We do meet with the family separately. We talk through what they see as the challenges for their loved one and for themselves. But if we were to follow what some of these many other states are doing, Family Caregiver Alliance has produced some documents for a while on the kinds of caregiver assessments tools you might want to use, because we often find that, especially in a spousal relationship, that the caregiver has as many, if not more, needs than the person that's coming in as our patient that we're seeing in the clinic. And so having an assessment then would help us better serve that family caregiver as perhaps the second patient. So I just want to give you all a real world example from what we see here in our clinic and the value we would have if we had access to and adopted an assessment. And then just a comment about the CARE Act, because this is something I've been working with AARP and following for a while. And Virginia was an early adopter of the CARE Act, which I was thankful for. However, I can speak to you as someone who sits in a healthcare system that we have 5 hospitals within our healthcare system. And if you were with your loved one, I would believe that you would get really good care. But upon discharge, if you said, hey, discharge planner or social worker or nurse, do you know about the CARE Act? What do I need to know how to do to take care of my loved one at home when I leave here? I don't know that they're going to know about the CARE Act. And we're trying to provide some education, but until it becomes a part of the DMV or the surveys that are done of our hospitals, where it's required or there is a penalty if you don't have it, it's not on the radar. And it's not that it's not important. And I'm certainly the one singing the praises within the hospital, but they're making staff are making comments like, so where would I do this demo? Where do I have space to do this? Who's going to do this? Who needs to be available? Because the discharge process is very fluid, as you all know, about when that's really going to happen. So I just wanted to kind of give you the perspective on both the caregiver assessment and the need for it, and the CARE Act legislation, which we have and passed, but it needs more support and infrastructure and even funding around it to make it realistic for healthcare systems to really adopt it and implement it. So with that, George, I'll pass it back to you for the next slide.
Thanks, Christy. Yep, next slide, please, Nick. So the third of the 4 components of the supporting family caregivers section is nurse delegation and scope of practice. This is one area where Virginia does pretty well. So we get 3 of the 4 points for nursing tasks which are able to be delegated. And as I said, that means what tasks a registered nurse can allow long-term services and supports direct care workers to do. So those could be things like medication administration or respiratory care. And overall, there's 16 tasks that are included here, and Virginia allows 12 of those to be delegated. In the nurse practitioner scope of practice, states can get 1 point if nurse practitioners are allowed to practice to the full extent of their education and training. So that would mean full practice authority, similar to a physician or somebody with an MD. Virginia is one of 12 states that restricts practice authority and requires a physician to oversee all care provided by a nurse practitioner. So that's an area that could be amenable to some change, with provided that there's enough advocacy to support that. Next slide, please. So the last component is transportation. This just has one piece, which is volunteer driver protection. So that is where states would provide legal protection for volunteers who are driving, say, a neighbor to a doctor's appointment, or to the pharmacy to pick up their medication, or to take them shopping. So the protections would be things that would be legal protection to say they wouldn't, insurance companies wouldn't be able to cancel their insurance or implement rate increases as a result of those volunteer driving activities. So having these kinds of protections can make it much easier to recruit volunteer drivers, and that can help address what remains a significant barrier to healthcare access, as well as things like social engagement, and particularly in more rural areas of the state. So this is an area where only 7 states provide this protection, which seems kind of incredible, given that when we look at social determinants of health, transportation always figures very highly. So instituting this kind of protection would be would seem to serve many of the most vulnerable people in our community. Next slide. So I'm going to turn it back over to Christy to talk about what activity actually happened in the General Assembly recently.
Yeah, thanks, George. And thank you all for the comments. I'll just note in the chat about both what the area agencies on aging are using and the Department of Veteran Services is using at the state level in terms of caregiver assessment. So I think what the coalition might be able to do is collect information about the kinds of tools that you're using, if they're evidence-based, or they've been around, they're used in other states, and how we kind of package that, to kind of show that we have a caregiver assessment. We maybe need to know where, how long, those kind of things. So discussion for another day, but thank you all for sharing that, because clearly you all already get it about why that assessment and a structured assessment at that is so important. So before we wrap up, let me just kind of fill you in on where we are with some activity in the General Assembly. So there have been some additional increases in funding for the long-term care ombudsman program. And then we've been looking, particularly, as you heard both David and George mention, opportunities for us to encourage our legislators to support a tax credit for family caregivers and to support some paid leave. And that can take the shape of, what George was mentioning earlier about some expansion of Family and Medical Leave Act, and who is eligible for that leave. He gave an example of a daughter-in-law who wouldn't be eligible. And so states are starting to kind of broaden their categories of that. And so there are about 10 different House bills that George and I have been following along with some colleagues at DMAS. And so I just wanted to highlight a few, and bear with me because I've got my notes in front of me, because as you know, the legislation gets wordy and a little cumbersome sometimes. And so I want to make sure I'm referring to things accurately. And if you haven't, you can just type in Virginia LIS, the Legislative Information System, to pull up almost to the date what has taken place in a timeline of any particular piece of legislation. And one of the first things that I like to do is kind of look at who is the patron, or who is our state senator or representative who has moved this forward. Because if they show an interest, then they're probably who we'd want to first follow back up with to say, what got you interested in this? Is this a personal caregiving experience that you've had, and build upon that kind of momentum. So most of the legislation that we could share with you has never made it to a vote. It's never made it out of committee. So, I mean, I guess you could say it's good news and it's bad news. So we've had a patron that's recognized some of these issues, has started to craft some draft legislation. It's maybe been even voted on and moved to a particular committee, but often it's tabled, or it doesn't make it to a point where it's even voted upon. So with House Bill 2137, that was, it did pass the House and the Senate, and will be signed. Actually, I believe the governor has signed that, and it will take effect on July 1. So the focus is narrow, though. So the leave is for, bear with me, let me make sure I'm on the right one here. For individuals who are considered essential workers. And so the expansion of some leave and paid leave is only going to be for essential workers, and that is defined pretty clearly in this legislation. So it's a start, but it is not an all-encompassing in terms of an expansion of paid sick leave, for example. The other that I just wanted to highlight, and again, you can kind of go to the LIS and take a look at 2433, House Bill 2433, the Family Caregiver Tax Credit, and then House Bill 328. I'll just give you a quick overview on those. So 2433 would provide a tax credit of 50% of the eligible expenditures that a family might spend if their loved one requires assistance with one or more ADLs, and could support up to $1,000. So we know from the Alzheimer's Association 2021 facts and figures that 60% of family caregivers, are spending a good amount out of pocket if they're providing care to a loved one with dementia. Out of pocket costs were more than $11,000 annually, and if the individual has some physical limitations, but not cognitive loss, it was almost half, at about $6,200 of that. And then with 328, when George mentioned this earlier, when we think about Family Medical Leave Act, it is typically unpaid leave. It's typically for an employment setting that has at least 50 employees. But the idea is that if you need to take time away, that your position is secure and will not be eliminated or passed to somebody else during your absence while you're managing your family leave. I think one thing that we've needed to do here within Riverside is explain to our employees. So we estimate, based on the surveys that we do annually, that 20% of our 10,000 employees are what we call double duty caregivers. So they provide direct care to our patients. They're our nurses, our doctors, our aides, environmental services, food services. They provide direct services to our patients, and they also are a default caregiver when they walk in the door at home. And so they're never off the clock. And that concept is not our concept. It's a Canadian concept of a double duty caregiver. So you work in healthcare, and then you become the default healthcare worker when you get home as well. And so what we found about thinking that at least 20% or 2,000 of our own team members in our health system fall in that category is that they don't know, one, about FMLA and how to apply for it, but they also didn't know that those who did know about FMLA didn't know you could take intermittent FMLA, which means you don't have to take the 12 weeks that are afforded to you at one lump sum or time, that it can be dispersed throughout a particular time period, and that your human resources folks will work with you to determine your eligibility and how you might take it on an intermittent basis. So we've been trying to do a lot of education among our own team members with that. But with House Bill 325 is indicating that there might be some additional paid leave, so that it wouldn't just be unpaid leave, but that there might be basically an insurance benefit that would guarantee you a certain percentage of your wages each week. And they were even listing in the legislation about 60 to 80% of your wages. And there may be a tax on that, a small tax. But interesting that that was kind of the approach, that it not just be unpaid leave, but be paid leave. So next slide, please, Nick. So again, I wanted to, there's my light bulb. That's my bright spot indicator to you, is that George and I didn't want you to leave here today, nor did David, thinking that Virginia is ranked 48th on support for family caregivers and that was the end of the story. There is a bright spot, and that's all the work that all of you and the agencies that you represent and your colleagues around the Commonwealth are doing. So keep in mind that the scorecard is only one indicator because of the limited methodology that it uses, because it has to have consistent metrics across all states and the District of Columbia. I wish there were a metric, if I could pick, that would be the number of individuals, number of caregivers you've served in your community because of an evidence-based program that you introduced. I could probably add several, and you all could as well. But right now we have the 4 that George described to us. So do keep in mind, we have been successful. We do have National Family Caregiver Support dollars, the Title III dollars that come into our area agencies on aging, and talk to those. Some of them are represented today about the amazing work they've done with those funds that are coming in to support caregiver education and resources, training, programming. You've heard about the great work that DARS is doing and looking to secure additional funding for the lifespan respite voucher program. And then many of you all are engaged, and we are within Riverside. I know DARS is, in particular, the area agencies on aging, the Alzheimer's Association, and education and training programs there's a variety of courses you can take to support your needs, whether they're psychosocial or educational or very clinical and nursing, your needs as a family caregiver for your loved one, and whether you're long distance in providing that care or, co-located. I did also want to remind you that, we have our state website, Virginia Navigator, that is a family of websites, but one of the components of the Virginia Navigator site is a Family Caregiver Solutions Center. So I provided you with the link to that. And then we've had the opportunity here within Riverside to partner with Virginia Navigator and create a caregiver tech tool finder. So I wasn't sure if you were aware of that. And again, I provided you with the link to it. I'll hyperlink to it and go to it in a minute if we find out we have time, but we're pushing up against our time limit with the presentation. But I just wanted you to know that the Caregiver Tech Tool Finder is basically in the tech speak, and I know who was that we spoke to earlier that's on here that could explain that better than I could, but it's a widget essentially. So it's a search feature. And so caregivers can go to the page that I've linked here, and there are a series of categories of apps. So do I want to know about apps that have been most highly vetted on family coordination and scheduling, or on medication management, or on meal preparation, or on managing my own self-compassion and self-care as a family caregiver? So those are in different categories, and we have about 50 different apps that we vetted through a variety of processes that you can then find based on certain categories. So instead of saying to caregivers, there are lots of apps out there, go take a look, this is at least one way that you don't throw folks out there kind of into the app world, but did you give them a little bit of structure by these categories? So if you're not familiar with the Tech Tool Finder, take a look at it. There's also an opportunity to add. So you can suggest, oh, you all didn't have this particular app, but I found it really beneficial, and we can explore how to get that one vetted and added. And then Nick and Chris may have more information about the soon to be unveiled, I believe, Caregiver Coalition guide, the Caregiver Guide, which is an exciting thing to be looking forward to coming. So next slide. So with that said, we really kind of just wanted to leave you with a little broader understanding of the long-term scorecard and where Virginia falls more broadly, and then more specifically with supporting family caregivers, but to also champion and celebrate the good work that we are doing, even if it isn't rolled up into that scorecard. And then think about what are the opportunities of the Coalition for Education and for Advocacy. So David's very clear that he can be in both those camps. He can provide you education and he can be an advocate. And I kind of walk in both those. And I think, when you think about somebody like George or others at DARS that because they are state employees, that they're happy to provide the education, but are unable to, representing a state agency, be an advocate. But we all can be advocates on an individual level. And so I think you can think about that. I'll give you an example. When the CARE Act was being considered by the General Assembly, and I believe Virginia signed it into legislation in 2016 or something, 2016, something around that. We were one of the early adopters of it, as I mentioned earlier. And we have a government relations person that sits within our health system that is, in front of the General Assembly daily when they're in session. And he did describe how difficult that was this most recent session with the pandemic and having to be distanced. And it's a very different approach to advocating. But he was keeping me posted on all the different legislation that might impact older adults. And there were several things around telehealth, but then here comes the CARE Act. And I had been already following it very closely. And so I was so excited. And I said, where is Riverside going to fall on this? What advocacy measure are we taking? And he said, we are neutral. And that was his response to me. So he said, you need to know that the health system is neutral on this. And I said, why are we not in favor of this or opposing this, which are usually your three choices that you find when you have an agency or individual advocating. And it was for those reasons I shared with you all earlier. Makes sense on paper. It's not funded. How is our health system going to implement the CARE Act in terms of having space and staff to manage this discharge piece and education and demoing techniques for family caregivers? And of course, they're going, well, it's the right thing to do and we should do that. And don't we get penalized for 30-day readmissions? Doesn't the CARE Act help with that? And again, I was told the health system is remaining neutral. What you kind of do on your own as an individual to advocate for family caregivers or this. So, I was thankful that it did pass, but we still have some challenges within our health system. And I have been in close contact with Inova, Centera, Bon Secours, and some of our other major health systems around the state. And some are a little further and some not so much in terms of how do you embrace the CARE Act. On paper, it makes great sense. But without the funding and the staff and the logistics and the space, how do you make something like that work? So I just want to give you that as an example. If you haven't done a lot of advocacy, David would be a great resource for you or others within AARP. But keep in mind the balance between you as an individual and what your employer might be expecting or taking a stand on in terms of some of this legislation. So with that, I'm going to pass it to Chris. And I think he wanted to kind of just open it up to get your input and where you see some opportunities here.
Christy, thank you so much. I mean, I so appreciate you taking the time to come in and lay this out for us. Are there any questions? We've gotten some good comments in the chat. And some of you have to leave. I'm seeing here Connie has to leave. There was one question from Danita. Christy, is there anything going on at the national level to expand funding for caregiver lifespan respite?
So I feel sure there is. I don't know specifically, and Kathy, I don't want to put you on the spot, but I don't know if you've seen that kind of from the state level since you all are continuing to secure lifespan respite dollars.
Well, in addition to the grant opportunity that we're applying for, we have received additional funds under Title 3E of the Older Americans Act for the National Family Caregiver Support Services. It's a substantial amount of money. However, all of the funds that we have received are tied up until the General Assembly has their special session, probably in July. I don't know if you're aware that in the last General Session, they passed basically a law saying that any funding that was coming in for COVID would have to basically be allocated by the General Assembly. And so I keep asking how the General Assembly can have any control over funding that comes to us directly from the Administration for Community Living for restricted purposes. And so I'm told that we will probably get all that money, but we will have to wait until the special session in July. And then we'll be able to allocate it out to the AAAs so that they can expand their caregiver support services.
And one other comment, I just was looking at my notes and realized I missed. If you all are not familiar with some of the work that Genworth is doing and the studies they have, particularly around working caregivers, they have done some studies both pre and during COVID about the impact of caregiving. So on work in particular, and your gender differences and who's able to remain in the workforce during this time. So Genworth is just another resource to you in terms of some of their caregiving studies. One of the most current ones was called the Genworth Caregiving in the COVID-19 Consumer Survey.
Muted. Any other thoughts? Paul, I noticed you had some comments about an article you wrote, if you wanted to brief us on that. I guess Paul. Yeah, there you are.
I wrote an article for the Adira Foundation pamphlet at their request, and the lady enjoyed it and asked me if I would like to become part of their advisory council at Adira Foundation to give them some input on, well, their funding decisions and that sort of thing. And I just want to let you know that if I get that appointment, I would like to also pass along any concerns you guys might have about funding requests.
Thanks, Paul. You are the consummate individual, family caregiver, and I appreciate your participation. You are the leading edge of many caregivers who are joining the coalition outside of our core of service providers. So thank you for that.
And thanks, Paul. I'll just add the Adira Foundation is a relatively new foundation in the Commonwealth. So they are looking at caregiving issues and aging issues more broadly. And they recently did some work with the National Alliance for Caregiving. So, I mean, they're not just planning on staying within Virginia, but having a national impact. But I mean, maybe that's an opportunity for them to come and speak about their work and get to hear from the coalition, and even in a coalition meeting.
Okay, Donna, will you make a note of that and see if they might be able to get on our education program list? Okay, thanks. Anyone else?
I would just like to briefly say I was invited here by Kristen Martin and Inova. I'm working with them on a project that I have going that is for working caregivers. It's on more work-life balance, psychosocial aspects. There are some things on talking to your employer, working out situations, but we are in the process of recruiting to test this. It's an online program. It has 4 modules in it, takes a couple of hours to go through. And we are paying people to do this. So if you know of any working caregivers that would be interested, or organizations that are interested in this, I'd welcome the opportunity to talk to you. And thank you all for the presentation today. It was very informative.
Okay, Diane, do you want to leave your email address in the chat box so that people can reach out to you if they can?
Yeah, yes, thank you.
All righty. Any other comments? I just want to thank all of you for participating today, and hopefully the coalition will be moving forward with providing some tools for communicating with legislators about these issues on an individual basis, not representing necessarily your organizations, but for you to tell personal stories about your situation. These are the kinds of things that our representatives really need to hear. And so, again, not writing as an employee of your service board or organization, but as individuals, I think is a powerful. On the powers that be. So hopefully with your help, we'll be developing some tools, some templates and things to use to reach out to our leaders. All right. Any other business that we haven't covered today? All right. Well, I just want to thank you and welcome to our new members. Thank you so much for participating. Just reminding you that we will be meeting again in July, and we'll be sending notices out about the program for that, and hopefully we can reconvene. That is on July 15th, and so mark your calendars now. And I'll just remind you that we do meet every other month. Every odd month is the general meeting, and hopefully the even months are executive committee meetings, and hopefully over the coming months we'll be able to invite a few of you who might be interested in coming and talking to the executive committee about specific projects or initiatives that you might have. So if you're interested in presenting to the executive committee, please, contact Nick and we will try to get you on the agenda. We're looking to expand our input for some of the projects that we have for the coalition, and we'd appreciate your participation. Really look forward to it. So without further ado, I'd just like to thank George, David, and Christy for a really terrific update. And this gives us sort of a stake in the sand to begin working to improve these scores on the scorecard. So thank you. Thank the three of you so much for that. Nick, I think we are ready to end if nobody else has comments.
Wonderful.
Okay,
All right,
thank you.
everybody. Have a wonderful weekend.
Okay, thanks everybody, and we'll see.
Thank you. Bye.
See you in July, not in Hawaii.